I think what's especially changed is how we understand and address suicide and suicidality. For a long time, we treated suicide as a symptom of like depression or another mental health disorder. But now we recognize that suicide is a very complex thing. And, you know, for some people, it's an instant life choice, and there could be absolutely no warning to their loved ones and other things of that nature. Over the years, we've taken steps to especially improve like screening and other things of that nature. Oftentimes, when you go into your primary care physician, they're asking you that question, have you had thoughts of suicide or been depressed recently? Which is a very great question to ask anytime that you're seeing somebody that's entering your healthcare system. That greater emphasis has helped connect people to resources faster. The evidence-based practice or training of QPR, or question, persuade, refer, has really spread like wildfire throughout the state, which has provided anybody, any lay citizen like you or I, kind of the ability to kind of know a little bit about the warning signs, as well as be able to ask the question to, a family, friend, acquaintance, somebody that we met off the street if they're thinking about suicide, and how to persuade them to get help, or persuade them that life is worth living and refer them to help. In mid-July, the National Suicide Prevention Lifeline will switch over to 988, which is really exciting. People can still call the old number and get connected, but 988 will provide an easy to remember suicide prevention and crisis line, which will also enhance a few capabilities around basically the main three prongs of 988 is, someone to talk to, someone to respond if you're in crisis, and somewhere to go. So especially there's been a number of great partners throughout the state that have been addressing that. Pandemic kind of put us in kind of a pressure cooker situation where we combine isolation for a number of folks trying to stay safe and not catch COVID or this unknown virus that none of us really understood back in early 2022. It combined that isolation with just that lack of social connectiveness, which oftentimes we as human beings crave, and not to mention the further rise of social media and kind of the false sense of connectiveness and just highlighting the good things. And that doesn't always lead to the best outcomes when we think everybody else is having the time of their lives and we aren't.